Kalai Chelvi Guruparan. Kalai Chelvi Guruparan. PS. Srija Ravindran. Good. Yeah. Yes. Right. So, those who have participated in the previous two sessions, okay, you recall your scores. Recall your scores. Okay. Questions 1 to 12. Scores. Those who have done questions 1 to 12, give me your scores, please. Those who have done your, yeah, Vinitha got 8 by 12. Good. Yeah, Avil got 7 by 12. Yes. What about the others? What about the others? Kalai Chelvi got 9. Very good. I'm noting down the regular students. So 9. Kalai Chelvi got, I have your scores here. Okay, Kalai Chelvi got 9. Vinitha got 9. Vinitha 8 you are typing there. Here you said 9. Okay, Rajalakshmi got 8. Muthu got 9. Muthu, why don't you give your marks? Simiyat got 8. Yeah. So, come on. Next. Questions 13 to 24. Okay. Scores. Yeah, questions 13 to 24 scores, please. Come on, all of you. Yeah, college shall be 8. We are going to do a lot of sessions like this now onwards. My target is 24 out of 24. 24 out of 24. Yes. Now, questions 1 to 24. Scores, please. Now, sum up both questions 1 to 24. Scores, please. Yeah, those who completed all the 24 questions with me. Give me your scores, please. Yes, of course. I don't mind if you people don't eat food today. I don't mind if you people don't sleep today. So 1, 2, 3 students. Muthulakshmi 17, Kalai Chelvi 17, Sajida Tabasam 18. I'm not very happy with your scores. You should get 24 out of 24. I will not rest until you get that score, provided you listen to me. Yeah. How does the doctor decide on the next steps? By looking at the patient's medical history, by looking at the patient's symptoms and exam, by looking at a scan of patient's abdomen. Yeah. Go through the question. Yeah, by looking at the patients. Okay. By looking at the patient's medical history, by looking at the patient's symptoms and exam. By looking at the scan of patient's abdomen. How does the doctor decide on the next steps? Yes. There you go. Yeah, go through this question because I'm going to discuss here. Okay. You hear a morning briefing on a ward. So there's a doctor and there may be some nurses or assistants. You have to study the question. We are going to study the question here. Those students who did not submit your attendance, those who did not submit your names, first name and second name, can please submit. Latecomers. Because next batch, part C, only those students, I'll send the message. Now brainstorming. Brainstorming begins. Very good. Welcome, Rakil. Yeah. Yes. There I am again. Yes. You hear a morning briefing on a ward. You hear a morning briefing on a ward. A hospital. In that hospital, there is a ward. In that ward, there is a leader. There is a doctor. Okay. The next one, there are some assistants. Is giving a briefing. Is giving a briefing. Briefing. A gist of what we are going to do. A summary of what we are going to do. Briefing. Briefing. Concise. Concise. Summary. Gist. Is there anybody who is writing these words in your notebook? Okay, nobody will write. You write at least. Write and submit me afterwards, please. Write down your notes. These words will come back to you. They will come like a boomerang and hit you badly. Some people, one or two people write on the chat box. You're learning here. You're not playing the fool. You're learning here. Make notes. The things which you're going to learn now will come back to you in the exam, and they're going to support you in a wonderful way. Briefing. Gist. Summary. Concise information. Precise. In a nutshell. In a nutshell. So these are some words which will come like this. Briefing. Another, it's a summary. Another place it's a briefing. Okay, a brief discussion. So here, morning briefing. Morning briefing. This is a briefing on a ward. And this briefing is held in the morning. Okay. Held in the morning. Morning, you'll tell about today's plan. Morning, you'll tell about today's plan. What you are going to do. Do this, do this, do this. Okay. This is what we are going to do. First we'll do this, second we'll do this, next we'll do this. Finally, we'll do this. So how does he decide? These are the next steps. Next, following. Successive program. Succeeding measures. Write down all of you. Next steps. Following steps. Successive program. Succeeding measures. Just giving an idea. Not exactly, but they will be reshaped. The future plan. The plan for the day. Procedure to be followed. Actions to be taken. Anything may be spoken there. Next. Next means coming. The coming. Course of action. The course of action. Plan to be implemented. Plan to be implemented. Anything. These are the styles it will come. That is the question. Next steps. You think he will tell the same words? How does the doctor decide on the next steps? Decision. On what basis? How? On what basis? How? How? What basis he is going to decide on the next steps? How is he going to decide? There are some next steps. He is deciding on the next steps. How? So the key word is how. Is going to how. Next steps is not important. Next steps will be there. Next steps will be there. I'm also taking next steps. I'm deciding how on your voting. You said, sir, give us part C. I said, part C I'll give. But I'll decide only to those students who are really serious, I'll give part C. Why I should give for everyone? Just because they're asking. How do I know that they are serious? First I gave part A, those students attended. Then I gave part B, students attended. Then part C, the list is being here. Then I'll give them part C. How? Now here I'm talking about a commonality factor. Commonality factor. The technique is commonality factor. Now what is commonality factor? Elimination of commonality factor. That means there is nothing special in this. You should know. Your eyes should not see these words. Your eyes should not see these words. Common. Don't want. Don't want. Do not want. Don't want. Okay. No need. We don't need these things. How to eliminate things? How to eliminate things? Your procedure. What are your next steps? I'm teaching you. This doctor is deciding on his next steps. I am a doctor. I'm an English language doctor. I'm deciding on how you have to take the next steps. Eliminating the commonality factor. So, elimination technique. Elimination, exclusive principle, exclusion principle, inclusion principle, exclusion and inclusion principle. There are two principles. And the third principle is exclusion as well as inclusion principle. We can also call it as inductive and deductive methods. Deductive means remain. Inductive means add. By is common. So it is not going to help us because in all the three by is there. Okay. It's common. Whatever is common is very important because it is unimportant. By is very important because it is not important anymore. You have to find out by which is common everywhere and eliminate it. It's important to be eliminated. It's important. You have to eliminate it. Then only the most important will come here. Something is important, just eliminate because it's common everywhere. Why 3 times coming? Because it is important. That means it is everywhere. Okay. Now looking. Then next. At. So by looking at is common. There goes without saying that these 3 words are unnecessary for us. Then what next? Learn the techniques. Common. Not important. Not important. Not important. And we know that it is patient everywhere. See the thing there. This is called exclusion principle. Put it aside. Put them aside. Which are common everywhere, put them aside. The words which are visible in every option, they are not important anymore. Just take your pen and cut it down so that only the best will remain. The best will remain. When you make butter out of curd, butter out of curd, right? Buttermilk. Okay. You try to, stir the buttermilk and the butter comes up. Then what you do? You take a sieve and lift it up. Water goes down. You take everything and pour it. Only the butter remains in the sieve and water goes down. You're filtering, okay, so that the only most important thing will remain. Unimportant things will settle down. So they are gone. Next to unimportant things are prepositions are not important. Prepositions are not important. Preposition is not important. So forget it. Because they will be everywhere. They are of least importance, just like that. And then conjunctions. Okay? Conjunctions. Right. So medical history, symptoms exam, abdominal scan, abdominal scan, abdominal scan, medical history, medical history, abdominal scan, symptoms and exam. So 6 words remained now. Now focus only on these 6 words when you listen to the audio. He decides based on the history. This is medicine only. This is medicine only. This is medicine only. The medicine is not important. History. Symptoms and exam. Doctors do exam. Doctors or medicine specialists. Okay. Doctors do exam. Doctors do scan. I'm eliminating one more layer now. So doctors do not belong to the nursing profession. They belong to the medicine profession. So it is whatever doctors do is related to medicine. They do the exam. They examine. They assess. They give an exam. They examine. Examinee. Examiner. Doctors are examiners. Patients are examinees. So patients are being examined. Examined. Now, you're scanning. You're scanning. Based on scanning, scanning what? Abdomen. Yeah. So now here comes the third layer, second layer. Okay. So medical history. So medical history. Examination. Assessment, evaluation, examination. Scanning is also one type of examination. Medical history. Medical. Okay. Previously examined history. Previously examined history is medical history. So exam is exam for the present medical condition. Scanning for the medical condition. Medical history for the past medical condition. Okay. So now remaining what? History, symptoms, and abdomen. What is the main word, which is very, very important? The three main words are, write down, nouns, history, symptoms, abdomen. All are nouns. All are nouns. If nouns are not there, then adjectives. Focus on these three words. Somebody write there in the chat box. Focus on these three words. Nouns, number one. Nouns are not there, adjectives. Adjectives are also not there, then verbs. Nouns, adjectives, and verbs. You have to focus on these things. How does the doctor decide on the next steps? Next steps are there, and these are decided by the doctor. How? How is the question? How is the question? The question word is how. How does he decide? His decision is based on what? His decision depends on what? His decision depends on the history. His decision depends on the symptoms. His decision depends on the present abdominal condition, abdomen. Okay, these are the three words that you have to focus on now. These are the three words that you have to focus on, right? Focus on these three words. Nothing is going to help you otherwise. Okay? The first one is history. Very important. Noun. Second one is the symptoms. The third one is abdomen. Focus on these areas. Patient's abdomen only, patient symptoms only, patient's medical history only. So patient is not important. We know that it is related to the patient. So this you have to be think about. These are the most important things that you have to focus. Okay. I hope you understood the essence of what I'm telling. You have some time to look at this question before the audio plays. How many seconds? 15 seconds. 15 seconds. 90 seconds in all. Okay. This is part C. Part B. 15 seconds. You will have time to read each question before you listen. 25 to 30. 15 seconds. 3 seconds for each one. 3 seconds for background. 25. You hear a morning briefing on a ward. He is giving a briefing regarding the next steps. He is giving a briefing regarding the next steps. So he is going to decide the next steps. Who is going to decide the next steps? The doctor is going to decide the next steps. And how is he going to decide? Is going to tell. You are going to understand. The next steps briefing is going on, and he is going to decide, and he will decide based on some measures. What are those measures? Based on history, based on symptoms, based on abdominal condition, abdominal scan. Okay. So based on these, any one of these three things is going to decide. What is he focusing? See, listen to that. That will be your answer. Be sharp enough, very fast to eliminate. 3 seconds, 20, the first line, 3 seconds for the second line, 6 over, and 9 seconds, 3 into 3, 9 seconds for the three options. So 15 seconds you have to study. This is how you have to study. Right. No need to go through all the things. Okay. Who is this iPhone again? Name please. Ria, is that you? Okay. Now let us look at this question. I'm going to play the audio now. Yeah. So that is the question. And I'm going to play the audio for you.
CT scan and volume repletion before she leaves, or have a close relative. Risk for abnormal.
He nodded.
Over the next 48 hours, I will have a series of.
He nodded when I explained to him that he should elevate his left foot and apply ice packs, but.
Who knows if he actually understood you, or if he will tell his daughter. Who are nearly ready for discharge. We have to take into account that these infants must have a close relative.
Infections or combinations of these etiologies.
I agree with you. So what is your next course of action?
Oh, fussy child.
CT scan.
Question.
Wait, please. I'm checking. Wait. I did not start the audio, no? Wait, please.
To maximize choice and value, we will make sure that you get a chair that meets your clinical needs, as well as your choices regarding fabrics and colors. The chair will be in your main lounge for at least a few months, if not more.
Yes, that will make my wife happy.
That is the end of part A. Now look at part B. Part B. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a morning briefing on a ward. Now read the question.
Hello all, so let's get started. Felicity, can you start off this morning's briefing?
Yes, I certainly can. So, first up, we have a 99-year-old woman with a history of high blood pressure, congestive heart failure and knee osteoarthritis. She's presenting with abdominal pain increasing over 5 days, along with obstipation in the last day. Exam showed abdominal distension, hypoactive bowel sound and no mass found.
Okay, so next steps?
Based on the symptoms and physical exam, an abdominal CT scan and volume repletion are the next steps.
Question 26. You hear a trainee nurse asking a mentor for advice.
Yeah. So don't write the answer until I tell you, please. Okay? Don't write the answer until I tell you, please. Okay. So, question 25. Yes. Submit your answers, please. 7, 6, 5, 4, 3, 2, 1. Submit. Wait until I tell you, submit. So here, how, on what basis? On what basis? How means on what basis? On what basis? He said, so you have to understand that one thing very particularly. Okay? You have to understand that one very particularly. He told all these things. Then he said, what about the next steps? What next? Okay? There comes the answer. Okay? I'm going to play that part now. Just focus on next steps. The person has next steps. Then she'll be answering those things. Now I'm giving you to confirm the answer. Now check how he is talking.
That is the end of part A. Now look at part B. Part B. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a morning briefing on a ward. Now read the question.
Hello all, so let's get started. Felicity, can you start off this morning's briefing?
Yes, I certainly can. So, first up, we have a 99-year-old woman with a history of high blood pressure, congestive heart failure and knee osteoarthritis. She's presenting with abdominal pain increasing over 5 days, along with obstipation in the last day. Exam showed abdominal distension, hypoactive bowel sound and no mass found.
Okay, so next steps?
Based on the symptoms and physical exam, an abdominal CT scan and volume repletion are the next steps.
So,
Question 26. You hear a trainee nurse asking a mentor.
now, you have noticed it very clearly. The answer is D. Question number 25. Answer. Correct answer. Yes. The correct answer is B. The correct answer is B. The correct answer is B. Because he said based on the symptoms, she told. Now what about the next steps? She told based on the symptoms and the physical exam. Based on the symptoms and the physical exam. An abdominal scan will be. So try to understand what he's telling. Based how? On what basis? How does the doctor decide? The doctors decide on a particular basis. Write down. How will you decide? Write down the points, the techniques. How will you decide? That means on what basis will you decide? How? Depending on what? Depending on what? Depending on what? Write down whatever words I am telling you, write down for this sort of question. All these different types of questions. You will follow these steps. How will you decide? How to decide? The question is how to decide. How to decide is in other terms, means on what basis? On what basis? Write down. On what basis? On what grounds? On what grounds? On what conditions? On what conditions? Now I am giving you another step. According to what? According to what? Depending on what? On is the key word. On is the key word. Decide on. Next steps will be decided on what basis? According to what? Depending on what? Due to what? Due to what? You'll take the decision. Due to so and so, you'll take the decision. Depending on so and so thing, you'll take the decision. According to so and so, you'll take the decision. Based on, you'll take the decision. On account of something, you'll take the decision. On account of. So all these words are very important for how. How. How means manner. Manner. Method. Strategy. Manner, method, strategy. Right. So how many of you got 1 mark? Give, write one by one. Those who did not get this mark or altered the mark, they will write 0 by 1. Please. 1 by 1 or 0 by 1. Arvil Narona, Deepak Moili, Hifza Jailani, Kalai Chelvi, Kiran Kaur, Muttu Lakshmi, Rajeshwari, Rakil, Ria Kader Kuttu, Sajida Tabassum, Simiat Abdul Rahim, Srija Ravindran, Sukhvinder Kaur, Vinita Mol. These are all regular students. All are registered regular students. All of you attend the sessions from tomorrow onwards, because tomorrow it is not an open session. Today I gave demo sessions. If anybody is interested, either who are watching on this Zoom platform or those who are watching on the YouTube channel, you can contact for subscriptions and attend the regular sessions on a daily basis. Welcome to the guests who are attending the sessions. Somebody else joined. Dr. Swati Nemade just joined. She is also a regular student. Okay. Yes. So those who got 1 marks, write 1 by 1. Those who did not get, just write 0 by 1. No problem. We don't mind. We are in the learning stage. We are not experts. Remember that. Yeah. Okay. Yeah. Yes. Question 26. Trainee nurse asking a mentor for advice. Why does the trainee ask his mentor for advice? Why does the trainee ask his mentor for advice? To confirm and support a possible diagnosis. To help him consider other possibilities like HIV. Explain to him what he should do next. You hear a trainee nurse asking a mentor for advice. Why does the trainee ask his mentor for advice? To confirm and support possible diagnosis. To help him consider other possibilities like HIV. To explain to him what he should do next. Yes. Go through this question. So here it is very clear now. I'm going to give you another technique today, now in this question. Go through these 5 points, 3 seconds for each line. The first one is the background, the second one is the question, and the 3 together they are the options. First one is the basis or the root, the second one is the stem, and the 3 things are the branches, the options. Out of them only one is right. Right. Now here, I'm going to give you some techniques. Follow it up. You hear a trainee nurse asking a mentor for advice. Who needs advice? Trainee, mentor, trainer. Trainee and trainer is related to training. So there is a training going on, and the trainee is taking training from the trainer. So who needs advice? Trainee needs advice. Trainer, training, trainee, all are common here. So while under training, he needs advice. He needs some advice. Okay. The trainee is asking his mentor for advice. Now, commonality factor. Commonality factor. The most important word is advice. Advice. And the second most important, no, the top most important is why. Why advice? Why advice? He's asking advice. Why? Why means what is the reason? Write down the words. Why means reason. Why means reason. Reason, cause, factor. Why means reason, cause, factor. Okay. What is reason for advice? Why is he asking advice? What is the factor? What is the cause for this advice? What is he expecting? Expectation. Expectation. So now here, why? Cause. Because I want something. That is the expectation. Because. Cause. Because. Write down the word because. Previous question same. Because. Because of this thing. Because of this thing. Because. Due to. Due to. Due to. On account of. On account of. On account of. On account of. Due to. Therefore. Therefore. He wants to know what to do next. Therefore, he's asking for advice. He wants to know what to do next. Therefore, I gave you a lot of times, I gave you these synonyms. Therefore, I want to know what I should do next. Therefore, I'm asking for advice. That is the reason why I'm asking for advice. Instead of therefore, hence, as I want to know what to do next, I'm asking advice. I'm asking for advice. As I want to know what to do next, I'm asking for advice. Okay. I'm asking for advice so that I will know what to do next. So that since I want to know what I should do next, I'm asking. Since means because. Since means as. So I want to know what I should do next. Hence, I'm asking for advice. So these are all synonyms for this type of questions. Why? Why? On what basis? How? In what manner? Why? Reason. Next. Now let us see here. Let's go to the options now. So here, advise why? Why advise or advise why? If you focus on this period, why advise or advise why he wants. What is the noun here in the first option? What is the noun here? Simon sir is trying to reach so many people. Okay, Simon sir is taking his time and explaining too many things. Grandmaster class is providing so many options. 1, 2, 3. Why don't you invite your friends? Why don't you spread the name of a grandmaster class? One student, one invite. Na? Why are you being so selfish? Pass on the information to your friends, right? 3 years back, I taught one student. She's a teacher and her brother is an engineer. 3 years back, when I was taking part B, she was calling and talking in my language. 3 years back, this boy studied with me. And he passed IELTS in the first attempt itself. After 3 years, today she calls me. I was surprised. Numbers will be always there with me. So I was surprised. So I stopped and I opened the call. Then I said, I remember you. Oh, sir, you still remember me? She did not have my number. She took the number from somebody else. Then I said, you are teacher, you are so and so, this fellow's sister or some relative you are. Yes, sir, you remember me so much. Thank you for remembering. Then she said, 3 days she was trying to call me. I did not pick up some number. Okay, I just took light. But I recalled when I was thinking deeply, that number came and I recalled. So I asked her, what is the reason? I'm in a class now. Tell me first. Then she said, sir, there is another person. Okay. He was telling me, I'm sending my daughter for IELTS. She wants to go abroad. I'm trying for some training. She's already studying in some institute, but she is not very happy. So then immediately she told, it seems, I'll give you my one number, but he's very serious. Okay. If your daughter is very serious, then approach him. So he called me 3 years back. Now she's bringing one. So that is, when you do something good to people, that is how good bounces back like a boomerang, which goes and comes back. Boomerang. When you do good, good comes back. I'm not just doing you good. I'm trying to give you the best. Can't you pass on the information to one particular friend who is really, really, really serious? Pass on, something good is there. Don't be selfish. Don't be selfish. Do you think you are getting all this knowledge because you are paying money? No. You are not paying any money for knowledge. Frankly speaking, you are paying money for my services, for sitting like this, folded legs and back like this. God bless me, I don't have back pain. God bless me, I don't have headache. Maybe because many students are blessing. The other day, Simiyat was blessing. God bless you very much. I pray that you live long. She told, you will not die sooner. Simiyat from Nigeria, the one who donated her fees to the Nigerian orphanage. I told, don't send me money. Donate it to the orphanage there. She said, you will not die sooner. That means you will live longer. Blessings. Bless me, na? Pass on the message to others. They will bless you. They will bless me. I'll get more blessings by others. So you are paying for the services which I am doing, sitting like this and explaining. Knowledge is there. Free in the world. God gives knowledge. I don't give knowledge to anybody. God gives knowledge to everyone. I'm just passing on that knowledge to you. So nobody is paying me for knowledge. You're paying me for my services. This, blah, 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 blah. So long I'm teaching. That services you are giving to simplify and explain. Knowledge is always there. Many people go to the YouTube. They don't pay me anything, but they say, call me, say, message me and tell me, sir, we got a lot of benefit from you. We are not your regular students. We did not pay even a single rupee to you, but we learned a lot from your YouTube lessons. But you know what? If their friend wants, or if their sister wants, or their brother wants, you know what they'll do? They'll not tell them my YouTube link. They'll say, Simon sir is there. This is his number. Go and contact him. That's what it is. Okay. Share with your friends. We are trying to do a lot of things. If you share to everyone, your fees also will decrease. Yeah. The next. So to confirm, what is the noun here? What is the noun here? In the first option, what is the noun here? In A, which is the most important word? Culminating into one particular, the entire, all the words will culminate into one particular word. What is that most important word? Dr. Swati Nemade. Is it a diagnosis? Is it a diagnosis? Ifat Jabin, is it a diagnosis? Muthu Lakshmi, is it a diagnosis? You are half blind. It's not a diagnosis, it is diagnosis. Don't you find the difference between singular and plural number? I asked what, there is no word called a diagnosis there. Why are you half blind? Why are you so hasty? Why is your mind frozen? Why is it not able to see the difference between I and E? No way. You can open your mouth and say anything now. You're caught blank. I asked you, what is the word? You're saying diagnosis. It is not diagnosis, it is diagnosis. Many, 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 not one. Diagnosis means only one. Diagnosis means multiple. Not one, but many options. That is the meaning. Just that E tells that not one, but many are there. There are many possible options. Not only one and only possible diagnosis. No, there are many other possible things. All those things. Remember that. So diagnosis is the main word. Noun. In the second one, what is the most important word? Other polities. Other polities like what? Other polities. What possibilities? Like what? Like HIV. HIV is one example. So HIV is the most important word. Like HIV, not just HIV, like HIV. Okay. Like HIV is the most important. Not just HIV. HIV is one example. Like HIV, anything may be. Okay. Then next. Third option, what is the thing? Third option, what is the next one? Only one word I want. So next means follow up. Follow up. Next is the word. Okay. Diagnosis. HIV. Next. First one is diagnosis. Doctors does. So doctor's action. Next one is diseases. Next one is follow-up. These are the three things. Diagnosis. He's asking for a diagnosis. He's asking for HIV or some other diseases. Next, he's asking for follow-up action plan. Plan of action. Follow-up. So which you have to focus? To confirm and support diagnosis. To help him consider other possibilities like HIV. HIV is one possibility. HIV and so on. HIV and so on and many more. What to do next? So what exactly is talking about? See the three steps. First one is it is not diagnosed. Second one is trying to diagnose. Okay. He found something and is trying to diagnose. And third one is now what to do. Next step, something we have done. Now what next? So the different stages. Before diagnosis, something is diagnosed and what others to be diagnosed. And already diagnosed, what should do next? Maybe diagnosis stage, diagnosed stage, post-diagnosis stage, pre-diagnosis stage, diagnosis stage, post-diagnosis stage. See their difference. Maybe pre-diagnosis, diagnosed, post-diagnosis. What next to do? So treatment, diagnosis, pre-diagnosis, diagnosis, and treatment or management. Maybe try to understand the idea here. Maybe it is right, maybe it is wrong. That is none of our business. But at least we are doing something, na? That's it. Okay. Right. We are going to play the audio again. Yes.
You're a woman with a history of high blood pressure, congestive heart failure and knee osteoarthritis. She's presenting with abdominal pain increasing over 5 days along with obstipation in the last day. Exam showed abdominal distension, hypoactive bowel sound, and no mass found.
Okay, so next steps?
Based on the symptoms and physical exam, an abdominal CT scan and volume repletion are the next steps.
Question 26. You hear a trainee nurse asking a mentor for advice. Now read the question.
Hello, Jane. I have a patient I would like to discuss with you.
Sure, tell me what you have.
I have a 32-month-old boy who was brought to the outpatient pediatric clinic because of weakness and failure to thrive. He is 3 kilograms below the expected weight for his age, and physical examination revealed a febrile, fussy child who does not like to be touched. According to his mother, he doesn't have diarrhea, but his appetite is poor. I mean, I know where the evidence is pointing me, but...
What working differential diagnosis are you considering for the child?
The mother and the child have never been tested for HIV, so that is a possibility, along with TB, malnutrition from lack of food, enteric parasitic infections, or combinations of these etiologies.
I agree with you. So what is your next course of action?
Question 27. You hear a nurse talking to another nurse about the discharge of a patient. Now read the question.
Right. So question number 26. Seven, 6, 5, 4, 3, 2, 1. Submit. Why are you so fast, Swati? See? The correct answer is A. The correct answer is A. Update your scores, please. Two by two, or 1 by 2, or 0 by 2. Right. So you have to apply the options like this. Why? Because he wants to confirm and support possible diagnosis. So advice regarding diagnosis, or advice regarding HIV, or advising regarding the following course of action. There may be many diagnoses. So confirm and support possible diagnosis out of the many diagnoses. There may be many possibilities. So what should we consider? Which possibility should we consider? For example, like HIV, and what else? Next one. Now we have done so many things. Now what should we do next? Okay. So that's the last option. So this is the way how you have to identify this question. Yeah. Question number 26. Right. Yes. So this is the way how you have to identify. So now it is 10:15. I'm going for lunch, dinner, right? So, right. So let us see here. Break for dinner. Break for dinner. So how much time shall we take? 15 minutes. Now it is 10 to 15. 15 minutes. This is A, option A. 15 minutes. Option B, 30 minutes. Option C. So Ifat Jabin doesn't want me to eat anything. Very good, Ifat Jabin. Thank you very much. C, 45 minutes. A, 15 minutes. B, 30 minutes. C, 45 minutes. Yeah. So I'm going for dinner. How much time will you give? How much time after we start? Yeah. Ria Kader Kuttu. Count how many A's. Ifat Jabin. Count how many B's. Sajida Tabassum. Count how many C's. Please. That is the decision. 4 B's, 1 C, and 6 A's. So we are going to join after 15 minutes. The break is, see, we are deciding based on what? How are we going to decide the next step of action? Based on your points. So, break 15 minutes. Break 15 minutes. Yeah, we are joining after 15 minutes. Thank you all. And yes, Josephine Mary is a regular student. Avil Narona is a regular student, and who new came now? Yeah, that's very nice. Thank you very much. We'll meet shortly.